Men with low testosterone may face higher early mortality risks. New study published in the Annals of Internal Medicine led by a team at the University of Western Australia. The researchers conducted a meta-analysis that combined findings from 11 high-quality studies examining the relationship between testosterone levels and lifespan. The studies tracked men for a minimum of 5 years and revealed that those with the lowest testosterone levels had an increased likelihood of premature death. While the study looked at deaths from various causes, a closer analysis indicates that heart disease, the leading cause of death among men worldwide, accounted for a significant portion of these cases. Interestingly, the mechanisms that contribute to heart disease may also play a role in erectile dysfunction, which is the inability to achieve or maintain an erection sufficient for sexual activity. Erectile dysfunction often manifests earlier than heart disease symptoms, serving as a potential warning sign for existing or future cardiovascular issues. Given that testosterone significantly impacts erectile function, this reinforces the connection between testosterone levels and heart health. Typically, testosterone levels decline as men age, decreasing by around 1% each year starting at age 30. This gradual decline is sometimes referred to as male menopause or andropause. This decline over time is partly attributed to the gradual reduction in the testicles' ability to produce testosterone, as well as a decrease in the signals that stimulate this production. However, various other factors, such as chronic diseases, can further accelerate this decline. The question arises, which comes first, low testosterone or disease? A limitation of the new study is its inability to determine whether low testosterone directly contributes to a higher risk of mortality. Testosterone levels can decline due to illness, potentially serving as an indicator of an underlying disease that increases the likelihood of mortality. This is particularly relevant in cases involving long-term inflammation, such as obesity. A pertinent example can be observed in prostate cancer patients. When the cancer progresses, they often receive treatments that significantly reduce testosterone levels. Although these treatments can effectively manage prostate cancer, they are also associated with an elevated risk of heart attack and stroke in patients. Thus, while low testosterone may indicate the presence of disease, it also appears to play a role in the emergence of subsequent health issues and possibly increased mortality. Determining what constitutes a low testosterone level can be quite complex.
Some of the problem with the low T advertising is that if you listen to all the signs and symptoms, it includes probably the majority of men in the United States. In terms of truly low testosterone, it's actually a very small fraction of the male population in the United States that's truly affected by this. One of the problems in making this distinction is that testosterone levels fall with age. I think men who have a definite change in their sex drive, libido, men who are need to shave less frequently, are losing muscle mass, body hair, notice their testicles are getting smaller, or if they're noticing enlargement of their breasts, these are signs and symptoms that should prompt them to talk about the possibility of low testosterone with their physician. If the levels are too high, it triggers the bone marrow to make more red blood cells, which makes the blood more thick and can predispose to stroke. High testosterone levels also can promote growth of the prostate gland.
Simply measuring testosterone alone may not provide a complete understanding of an individual's ideal levels. What is considered low for one man may not be the same for another. Researchers establish normal testosterone ranges by analyzing average levels from various populations, which helps highlight individuals who fall outside of these ranges and may have related health issues. This approach aids doctors in identifying and treating patients who may require assistance. However, generalizing these findings across different populations can be challenging and often necessitates larger sample sizes to reveal meaningful trends. A recent meta-analysis indicates that the heightened risk of mortality in men primarily becomes evident when testosterone levels are significantly low. It's important to recognize that, regardless of what is classified as normal for each individual, decreased testosterone levels can heighten the risk of mortality. Maintaining healthy testosterone levels. Considering the risks linked to low testosterone, you might be curious about preventative measures. Men should strive to avoid factors that lead to reduced testosterone by embracing a healthy lifestyle and managing their weight effectively. If levels are already low, testosterone replacement therapy may be a viable option to consider. There is increasing evidence indicating that testosterone replacement therapy may help lower certain risks, including mortality from various causes and heart attacks, in some men. However, controversy still surrounds this treatment, as long-standing and often outdated concerns about testosterone therapy contributing to heart attacks persist.